So let us begin now. So basically enamel forms the protective covering of the tooth, and it is the hardest calcified tissue in the body. This also is one of the questions. You can
Body
have
is enamel.
you can have the options of dentine, bone, many options do come, but of course enamel is the right answer, right?
Yeah.
The basic composition of enamel is hydroxyapatite crystals, and 4% of it is the organic material, which is the amylogenin and the non-amylogenin protein. Amylogenin and non-amylogenin is one another question you get. Usually, it is also asked that usually they tweak the question like that. What is the basic composition of enamel? Is it 90%, 10%, 92%, 8%? They can tweak the question like that.
Okay.
Yeah.
Yeah.
Now is the basic structure, as you must be knowing, the basic structure of enamel is the enamel rods.
Enamel rods. Yeah.
So the enamel basically consists of millions of enamel rods, which basically have a keyhole structure. This is also one question: keyhole structure or laminated structure. You get many options in that in exam, right? So from dentilo-enamel junction, the enamel rods, as you know, they don't have a straight course. It's a tortuous course for them. It's a wavy course, right? The length of the most of the rods is greater in thickness, and they have an oblique direction. It is claimed that
the length of the rods is thick and they're oblique in direction. So is this important that they're oblique in direction?
Oblique in direction is important. Yes.
Okay.
So there is a reason why they are oblique in direction, to increase the stress-bearing capacity of the enamel, right? Because enamel bears a lot of masticatory load. So oblique, the direction of rods is oblique. It is better for enamel to bear the masticatory load. Clear?
Structure, yeah.
Now this is one of the other question, like this one. It is claimed the diameter of rod increases from the dentino-enamel junction towards the surface of the enamel at a ratio of 1:2. This 1:2 has been asked in exam. Okay.
Diameter increases 1:2 from the dentino-enamel junction to the surface of the enamel. Okay.
Yes. So this is also one of the questions.
Yes.
Yeah. Now, important features of the enamel. As you know, enamel, we have different structures, which are, some are the surface structure of enamel. Some of these structures are inside the enamel. So all of these basic structures of the enamel form a very important question in ORE. They ask a lot of questions from these structures of enamel. So first is the gnarled enamel. It is an optical appearance. This is very important. From the cusp tip and incisal edges, the enamel is more intertwined and irregular when seen in an oblique section. So as you know, that enamel, of course, doesn't have a regular structure. The enamel rods are intertwined and they're irregular. So when you cut an oblique section of the enamel and see it in a ground section, you will see the irregular course of the enamel rod. That is called the gnarled enamel. Is it clear to you, Aisha?
Yes, it's clear.
Yeah.
And the optical appearance is seen when we cut it obliquely, like the optical appearance of the, or it's like generally?
No. This is when you cut an tooth section obliquely, then only you see the gnarled enamel.
Okay. And it has an optical appearance.
It is not actually present, but it is an optical appearance.
Okay.
Yeah.
Got it.
I have included a figure. See, this is the gnarled enamel.
Yeah.
HS bands or the HUNTER-SCHREGER bands. These are basically responsible, as we spoke in the earlier part, that rods do not have a straight course. They are intertwined. They have an irregular course, which is responsible for HS bands. These are alternate light and dark bands seen in the longitudinal section. This is very important, Aisha. Okay. The gnarled enamel is seen in the oblique section, and the HS bands are seen in the longitudinal section. Yeah?
Yeah.
So they originate from the dentino-enamel border and pass outwards, ending at some distance from the outer enamel surface. So these doesn't come in the surface structure. These are present inside the surface. So questions do come in the exam. Which of the following are the surface structure of the enamel? So HS band is not a surface structure.
Okay.
Yeah. I hope I'm clear to you.
Can you just repeat this Hunter-Schreger band again? I was following up with them.
No problem. Hunter-Schreger band are responsible because as we discussed, the direction of rods is not a straight course. It is a wavy and a tortuous course, right? So this is responsible for the HS band, and it is an alternate light and dark band seen in the longitudinal section, Aisha. This is important. Okay.
Okay.
We discussed gnarled enamel is seen in the oblique section. HS bands are seen in the longitudinal section. Yeah. They originate from the dentino enamel border, pass outward, ending at some distance from the outer enamel surface. So they are not obvious on the surface of the enamel. They are not the surface structure. These are present on the inner side of the enamel.
Okay, they start from the dentino enamel border and pass outward, ending at some distance from the outer enamel surface.
So they are not visible on the enamel surface. So this is also one question. Which of the following are the enamel surface structure?
Sorry, I have to ask when they pass from the enamel junction border. I understood that part, but they are at some distance from the outer enamel surface. There's some distance away from the outer enamel surface, so they're not seen on the enamel surface.
Exactly, they are not seen on the surface of the enamel. Clear?
Okay. Yes.
Yeah. Now we come to the incremental line of ridges. The incremental line of ridges are brownish band in ground section of the enamel. They illustrate the incremental pattern of enamel. That enamel is found in successive apposition layers, right? It is laid down in layers, the enamel. So that is depicted by the incremental line of ridges in the ground section of the enamel. Clear?
Okay.
Brownish
bands in the ground section of the enamel.
Yes. If you have any question, feel free to stop me, Aisha.
I can understand the incremental lines of ridges. Like they appear. They're just like there.
Yeah, they are there.
I didn't get that part.
They are not an optical illusion. They are there, and they are basically responsive. They are basically represent that enamel is formed in apposition layers. You must be knowing, right? The enamel is laid in layers. So there is they are present at bands between the two layers of enamel. So these brownish bands are called incremental line of ridges. Huh?
Okay. Yeah. So between two bands of they're in form of layers, the enamels in the form of layers, and then between two bands, the incremental lines can be seen on the band.
Yes, that's what I meant. Okay.
Yeah.
Okay. These are the neonatal lines. The neonatal lines are the accentuated stria of ridges, denoting a disruption in the amelogenesis. For example, if
the neonatal lines are in bone also, right? Neonatal lines you see in on the teeth. You see neonatal lines. I studied this in ortho, and like there's like some lines left that tell the age or something. I forgot.
Yes. So neonatal line basically they represent that when the enamel was forming, there was some disruption. So they it was not laid down continuously in layers, right? So that is why it gives the accentuated means more dominant stria of ridges when you see in the tooth. Clear?
Okay. Yes.
Yeah. These were the structure which are present inside the enamel, Aisha. Now we will discuss the surface structure of the enamel. Okay. The most important, I have laid them down here. These are the pericymata. Pericymata are the transverse wave-like grooves and are surface manifestation of stria of ridges. So stria of ridges, as we discussed, they end some point behind or inside the outer enamel surface. You remember?
Yes. Yeah, away from the outer enamel surface.
Exactly. But their external manifestation is seen as pericymata.
Okay.
Clear? They are continuous around the tooth and parallel to each other and to the dentino-enamel junction. Clear?
Yeah, they are continuous around the tooth and are parallel to each other and the okay. They're continuous and parallel.
Yeah. Now is the enamel tuft. Enamel tuft are just ribbon-like grass, ribbon-like thin structures which are present in the inner third of the enamel. These are also not surface structure, but I've included here. There is a reason behind that. These are hypocalcified enamel rods and interprismatic substances. When these tuft extend up to the full length, they become enamel lamellae. So,
sorry, can you repeat this again? I didn't understand this.
I'll show you in a diagram. See, now can you see? This is the dentine. This is the enamel.
Yes. Yes.
From dentine to enamel junction, these are hypocalcified rods, right?
Okay.
Enamel tuft. When these tuft extend up to the surface, they become lamellae.
Okay, so they extend from the enamel junction, but when they reach the end of the enamel, then they become enamel lamellae.
Perfect. Clear?
Yes.
Yeah, good. Now is enamel spindle. Enamel spindle is associated with heavily scalloped dentine enamel junction and represent odontoblastic processes that have embedded into the first zone of enamel formed. So basically, you know, sometimes when the enamel has been laid down, the odontoblasts get trapped in the enamel between the enamel layers, right? So these form the enamel spindle. They are club shaped and mostly present in cusp tips. That's why they are called. They are usually, because you know the enamel starts getting laid down from the cusp tip. If you remember the process of enamel formation, you remember? When it is laid down from the cusp tips, many odontoblasts, they become embedded between the layers of the enamel and they become the enamel spindle.
Yes, yes, yes.
Clear?
Yes.
Yeah. Now is enamel cuticle. It is present on newly erupted tooth and is soon removed by mastication. It is secreted by ameloblast. It is also called the Nismuth membrane.
Oh, I've read this name Nismuth membrane and I forgot what it was.
Yeah, Nismuth membrane is usually present when the tooth newly erupts, and it is worn off away when we start using the teeth. So it is basically secreted by the ameloblasts.
Ameloblastoma. Yes, ameloblast.
Yeah. Any questions?
Secreted by the membrane. No, this is good.
Yeah.
Yeah, I understand.
Good. Now moving to the structure of dentine. See, dental histology, many questions are asked, Aisha. So all these band structure, they have to be really learned by heart. Okay?
Yes, yes.
Yeah. Now the dentine, it forms the main bulk of the teeth, is formed by calcified dentine. This is a very important line. It is asked in the exam. What tissue forms the main bulk of the tooth? Dentine. Okay?
Yes, yes.
Dentine is somewhat harder than the bone, but softer than the enamel. In exam, what they do is they give you a multiple choice question. Arrange the following in the order of hardness: enamel, dentine, bone, bone, dentine, enamel.
Yeah, I've seen this MCQ in a mock ORE paper. I've seen like which is hardest is dentine, enamel, bone.
Yeah. So
it's dentine.
Enamel is the hardest, right?
Yes.
Yeah. Sorry. And then dentine, and then bone. Bone is the softest among the three.
Yes.
Clear?
Yeah.
Yeah. Now the basic sorry. The basic composition of the dentine consists of 35% of organic, 65% of inorganic. The organic part is basically hydroxyapatite, and the organic is type 1 collagen. This is also a question. They do ask what is the type of collagen in dentine, in primary dentine. So you will say type 1. Okay. Now, types of enamel. In a fully mature teeth, dentine. In fully mature teeth, dentine is basically of 5 types, right?
Yeah.
First, dentine, which is formed before the root completion. This is a very important line. Before the root completion is primary dentine.
Primary dentine.
Yeah. The primary dentine is basically of 2 types: mental dentine and the circumpulpal dentine.
Yes.
Yeah.
Yes.
Mental dentine. Mental dentine is the first form dentine. This is a very important question, very frequently asked in ORE. Which is the first form dentine? It's a mental dentine.
Mentine.
Yeah.
Yes.
In the crown underlying DEJ, this zone below the DEJ is soft and thus provides the cushioning effect to the teeth. Okay?
Okay.
Circumpulpal dentine. Circumpulpal dentine forms the remaining primary dentine or the bulk of the tooth. This is also a question, which kind of dentine forms the bulk of the tooth? Not the mental dentine, tertiary or any dentine. The circumpulpal dentine forms the bulk of the teeth. Okay?
Okay.
The collagen.
But if it's but bulk of the teeth is formed by dentine also, right? That can also be them. Depends on the options.
Yeah, it depends on what option they give you. If they ask within dentine, which dentine forms the bulk of the teeth, we will say circumpulpal dentine. Yeah. The collagen fibrils in circumpulpal dentine are much smaller in diameter and are more closely packed as compared to mental dentine. The circumpulpal dentine may contain slightly more mineral than the mental dentine. Okay. I've compared both the dentines here, the primary dentines. Okay.
Yes.
See, I have put a diagram here. So mental dentine is this dentine. We told you it is just below the DEJ.
Yeah, it's below the DEJ under the crown.
Yes. And this is the circumpulpal. Circumpulpal means circumscribing the pulp. So it is around the pulp. Clear?
Yeah, it surrounds the pulp.
Yeah. Now, this was the primary dentine, which was formed below the root completion. Now comes the secondary dentine. Secondary dentine is a narrow band of dentine bordering the pulp and representing the dentine which is formed after the root completion. It is formed throughout the life. This is very important, Aisha. It is formed throughout the life at the periphery of the pulp at a low rate. Okay? Dentine.
But the circumpulpal dentine was also surrounding the pulp. So second dentine also surrounds the pulp.
Yes, but the difference is it is formed before the root completion, and this is formed after the root completion. Let us see have a look at the diagram again. See, this is the secondary dentine.
Yeah.
And this is the blue one is the circumpulpal dentine. This is the circumpulpal dentine. Can you see?
Okay.
It is
the blue one is circumpulpal dentine, and the second dentine is the white one.
Yes,
yeah. The dentine is the inside, right?
Yeah, it is important because see, the most of the pluripotent cells, the cells which are responsible for laying down the dentine, the odontoblasts, which are usually migrating from the pulp only, right? So when they migrate from the pulp and they lay down, they keep laying down the dentine surrounding the pulp. But it is called the secondary dentine. Why? Because it is made after the root completion.
Okay.
Any confusion?
No.
No?
I understood now.
Now the tertiary dentine. The tertiary dentine is the reparative, responsive, or the reactive dentine. All these are the names of the tertiary dentine. It is asked in the exam.
Dentine, yes.
This is a localized formation of dentine. Localized. Why? Because wherever there is any trauma, tertiary dentine is formed. Otherwise, it is not laid down throughout the life of the forming as secondary dentine. Clear?
Yeah, it only forms in response to trauma. It doesn't form normally, right?
Yeah,
it's normally just stationary.
Yeah. So this is localized formation of dentine on pulp dentine border, formed in reaction to trauma such as caries or restorative procedures. Yeah, tertiary dentine differs from primary dentine in that it contains type 1 and type 3. Very important. Primary dentine only has type 1 collagen. Tertiary has type 1 and 3 both. Okay. Yeah, this is also a question which is asked.
But in normal dentine, we classify the organic part as type 1 collagen, right? Like in the composition that we read in the beginning.
Yeah. But in tertiary, it is type 1 and 3 both.
Right. Okay. Yeah.
Now, these are various lines of dentine. Incremental line of von Ebner. These are the lines as striations in dentine. They run at right angles to the dentinal tubules. These represent the rhythmic deposition of the dentine. So these are only present in the secondary dentine, Aisha, because secondary dentine is the only dentine which is laid out throughout the life. Okay, so this will not be found in the primary dentine. So rhythmic deposition represents the incremental line of von Eppner. Clear?
So these lines are only formed during secondary dentine, not any other dentine formation.
Yeah, because it is the rhythmic deposition. As we told you, very slowly around the pulp, secondary dentine is deposited, right?
Yeah, because that forms throughout the life. So these lines forming there.
Yes, yeah. Now the contour line of oven, occasionally some of
Can you give me 1 minute? Sorry to interrupt. Just like 1 second.
Yeah,
Thank you.
Yeah.
अब बिरयानी नहीं खाने तुम मैं परवाह ही नहीं होएगी तो खाऊंगा कल ऑर्डर कर सकते ना हाँ पानी उसको बना सकते ओके थैंक यू सॉरी यस
Are you ready?
We live in hostel. Yeah, we live in hostel, so we have a lot of food problems and other problems.
No, I understand. It's difficult, right? You ready now?
Yeah.
Occasionally, some incremental lines are accentuated because of disturbance in the matrix and mineralization process. Such lines are called contour lines of oven in dentine.
Yeah, okay.
Yeah, this is also asked. Now these are
also formed due to disturbance, right? In mineralization and matrix. Before there were lines that formed due to disturbance were neonatal. I remember this neonatal line. Yeah, neonatal line were due to disturbance in the stria of it.
In the amelogenesis.
Disturbance in the amelogenesis. Yeah, disturbance in the amelogenesis.
Yeah, so this is a disturbance in the dentinogenesis. They will become contour lines of oven.
Okay.
Now the neonatal line in deciduous teeth and first permanent molars, when the dentine is partly formed before and after birth, prenatal and postnatal dentine is separated by a contour line. This is termed as neonatal line and seen in enamel as well as dentine. See, when there is a birth of a child, there is some disturbance in the formation of the enamel or dentine. So the neonatal line are only seen in deciduous teeth and first permanent molars. This is very important, Aisha, because at the time of the birth, only enamel and dentine of first permanent molars and incisors is formed, right? So so at the time when prenatal and postnatal dentine is separated by neonatal lines. Okay.
So there's like neonatal lines also present in enamel also and also in dentine, right?
Yes.
So
it says
so they can ask about both.
They can ask anything. Yes. They will give you a description, of course, that if there is a disturbance in dentinogenesis, what is the line? Neonatal line. Okay. Yeah. Interglobular dentine. Some mineralization of dentine begins in small globular areas, which fail to coalesce into homogeneous mass. This zones of hypomineralization between the globule is known as interglobular dentine. This is not commonly asked, but still, I have included everything.
Yeah. I understand. Anything can be asked.
Yeah, anything can be asked. Predentine, it is a layer of variable thickness that is innermost.
Can I ask a question? What is small globular areas?
Small globular areas is, for example, when the mineralization is occurring in a dentine, it is not laid down as a matrix. Sometimes mineralization is occurring in small spots, right? And if they fail to join together and form a homogeneous mass, then it becomes an interglobular dentine.
Okay.
Predentine is the layer of variable thickness that is the innermost layer of dentine at the periphery of pulp, that is circumpulpal only. It's called predentine as well. Okay.
Circumpulpal dentine is also called predentine.
Yes.
So it's also part of the primary dentine.
Yes, circumpulpal dentine is the part of primary dentine. Yeah. A granular layer of tomes, when the dry ground section of root dentine, it is present in the root dentine, can be visualized in transmitted line. A zone adjacent to cementum appears granular. This is known as tomes layer. So this is
adjacent to the cementum and appears granular.
Yeah. This is only seen in root dentine.
Root dentine, yeah. Okay.
It is important. And seen adjacent to the cementum that appears granular. It is called tomes layer. Okay.
Okay.
Reparative dentine, we already studied, but I have still put you just for knowledge again. Reparative,
Like, yeah,
tertiary, or response.
tertiary dentine is reparative
Yeah,
dentine.
yeah, yeah. If by extensive abrasion, erosion, caries, this is commonly asked, which dentine will be formed in the patients with erosions? Reparative. Yeah.
Yeah. Okay.
Or operative procedure, the odontoblast processes are exposed or cut. These odontoblasts die or survive depending on the intensity of origin. If they survive, the dentine that is produced is reactionary, regenerated, reparative, tertiary. All these are similar. They are same things.
Okay.
Okay. Now, this is one important point. Most mineralized part of dentine is the peritubular dentine. This is a very commonly asked question, Aisha.
Part of dentine. Most mineralized part of dentine is peritubular dentine. Okay.
The dentine which is surrounding the dentinal tubules. Peritubular. Peritubular means surrounding the tubes of the dentine, tubules of the dentine.
Okay.
Yeah? It is 40% more mineralized than intertubular. Okay?
Okay.
Yeah.
Yes.
Now this is the this is the, just for your knowledge, this is the mental dentine. As I told you, it is below the cusps, right?
Yeah.
Yeah.
Under the crown.
Yeah. And this is some kind of a trauma, we can say. So
Okay.
here it is from the tertiary dentine. See?
Dentine.
Here it is caries. Here is also caries. This black part is the tertiary dentine. This is the secondary dentine, which is surrounding the pulp.
Yeah.
Okay. This is the predentine. This is the primary dentine. Clear?
Okay. When after root completion, the second dentine is formed. So after that, is the circumpulpal dentine is that still there, or it's gone?
Circumpulpal dentine is gradually formed throughout the life, because see, tooth is always exposed to some or the other trauma, like cavities or high load of mastication. Why it is formed surrounding the pulp? Because cells from the pulp only migrate, they become odontoblast, and they keep depositing a small thin layer of dentine surrounding the pulp always, and it protects the pulp as well, right?
Yeah.
And whenever there is insult to the dentine, tertiary dentine is deposited only on those spots, not throughout the dentine. Can you see these black spots? Okay. This is tertiary dentine.
Yes.
Yeah.
Yes. Yeah.
So this is the base. This is the basic structure, and this is the basic outline of the lesson for today.